Good morning, everyone. So my topic for this morning is dengue hemorrhagic fever. So uh, the objective for this study is this case presentation aims to identify and determine the general health problems and needs of the patient with an admitting diagnosis of dengue hemorrhagic fever. This presentation also intends to patient promote health and medical understanding of such conditions through the application of nursing skills and for the gain knowledge, skills, and altitude of students. So the overview of medical diagnosis. Dengue fever is a disease caused by a family of viruses transmitted by infected mosquitoes. It is an acute illness of sudden onset that usually follows a benign course with symptoms such as headache, fever, exhaustion, severe muscles and joint pain, and also swollen lymph nodes and rash. So it was first recognized or discovered in the 1950s during the dengue epidemics in the Philippines and Thailand. It can transmit through mosquito bite from one infected individual to another individual, healthy individual. So the manifestations of dengue hemorrhagic fever is included headache, fever, rash, and evidence of bleeding or hemorrhage in the body. So the prevalence and statistics according to the World Health Organization there are 2.5 billion people who are at risk for being infected with the dengue virus. They also estimated that 50 to 100 million infections of dengue fever occur yearly. Um, and also, based on WHO, the data that they gathered, that there are 1.3 million cases in 2008 in America and Western Pacific and Southeast Asia. And in 2013, there are 3 million infected in America and 37,687 are DHF. So after the first known epidemic in 1953 and 1954, the dengue virus continued to spread through Southeast Asia. So the prognosis, dengue fever is a self-limiting disease with a mortality rate of less than 1%. So when treated, it has rate of 2 to 5%. When left untreated, it has a mortality rate as high as 50%. So those who survive usually recover without sequelae and develop immunity to the infecting serotype. So the worst symptoms of illness typically last 1 to 2 weeks, and most patients with full recovery within several additional weeks. So the overview of care, there is no specific medicine or treatment for dengue, but you can treat the symptoms. Pain reliever with acetaminophen is used and avoid aspirin and NSAIDs do not worsen the bleeding. Resting and drinking a lot of fluids can help, and if the complication worsen, see the doctor. So this is my part. Thank you.
Okay, let's now move on to the patient's database. So before that, let me introduce myself. I am Hannah Joyce Limbaro and we'll be discussing the patient's database. So first, we have the um, we have her health history. So, patient AMC is a 14-year-old female living in Chamo, Pasay City, Manila, and she was born in Manila last August 26, 2005. She is a Filipino and Roman Catholic, and she's still in high school and was admitted in MAMC for an uh, due to dengue fever with the chief complaints of nilalagnat siya ng ilang araw as verbalized by the mother. So next is the history of present illness. So 9 days prior to admission, patient AMC experienced productive cough, active cough and cold, and she also had a fever and was given an antipyretic medication or biogesic. So several days symptoms still persist, so the family decided to uh, bring her to the hospital, um, and she was consulted by the doctor, and after physical and several assessment was done, the patient was diagnosed with dengue fever under Dr. Elton Frias. Next is the past medical history. So um, uh, patient has never been hospitalized before, and that she only experienced fever, cough, and cold, and her family visit barangay clinic sometimes to seek medical attention. Okay, so the family history. So according to the mother, the only disease that runs in their family is diabetes mellitus and hypertension. Okay, so let's move on to the personal social history. So under the personal and social history, we'll be talking. First is the health maintenance perception pattern. So before hospitalization, patient perceived that she is healthy and she's in a state of a good condition. But during hospitalization, she thinks that she is not healthy due to her illness. Next is nutritional metabolic pattern. So before hospitalization, patient's appetite is normal, and that she eats vegetable, fish, meat, and there's no any diet and any supplementary vitamins that she takes. And while during hospitalization, the patient eat what is being served by the hospital, and she was also advised by her doctor to have a that diet or diet as tolerated except dark colored food, and and she also experienced nausea and vomiting, and because of that she lost weight. Next is elimination pattern. So before hospitalization, patient was able to urinate and defecate normally, but during hospitalization, patient are still able to urinate and defecate by herself, um, but she was assisted by her mother, and she was also instructed by her doctor that she needs to be on a complete bed rest and bathroom privilege. Next is activity and exercise. So before hospitalization, the patient was able to do independently the activities in daily life. So, but during hospitalization, she was able she was able to do some activities, but with the help but with an assistance by her mother or with the help of her mother. And then next would be sleep and rest pattern. So before hospitalization, patient had a regular sleeping pattern at around 9 p.m. to 5 a.m. to prepare for school. And but during hospitalization, patient had a disturbed sleeping pattern due to adherence to the time of medication and vital sign monitoring. Next is cognitive perceptual pattern. So before hospitalization, um, before and during hospitalization, patient is conscious and coherent, and she also responds very well to verbal and physical stimuli. She also cooperates. She also cooperates well to the doctors as well as, and sometimes as well as to the nurses. Next would be the role relationship pattern. So, before hospitalization, patient was able to do her responsibilities as a daughter to her parents. But during hospitalization, she questions her mother and sometimes talk back to her, and it is because she's not aware of the perform she is not yet aware of performing her role in this kind of field. Next would be sexuality reproductive pattern. So patient uh, doesn't think of any doesn't think as of the moment to have boyfriend or getting married. It is due because to his youthful mind, and it is not still her priority in life. And she mentioned before that she wants to focus on her studies. Next would be coping stress, self perception, or self tolerance. So before and during hospitalization, patient doesn't fully identify her stressors, but she cooperates to the doctors and to the nurses as well. Next would be values, belief, and patterns. So the patient is a Roman Catholic, and uh, uh, patient is a Roman Catholic, and it was influenced by her parents and their culture. Yeah, it was influenced by her mother or her parents. Okay, next would be the review of systems. So this is the findings last February 19, 2020 of her vital signs, her blood pressure, heart rate, respiratory rate, and temperature. And as you can see, her temperature is high. So she had the fever last February 19, 2020. The next findings would be the next day, which is February 20, 2020. So we get her vital signs, her blood pressure, heart rate, respiratory rate, and temperature. And as you can see, her temperature now um, is within normal, and but her blood pressure during 11 a.m. to 1 p.m. is very low, 80/50. Head to toe physical assessment. So the first areas that was being assessed is the skin. So the patient had a light skin and there is no lesion or inflammation found, but she has a scars on her legs. She also have a dry skin and has a poor skin turgor. Her nails are pink in color and there is no inflammation or lesion found, and the capillary fill is within normal. The head are proportioned to the body and it is symmetric. Next, her hair is black in color and it is slightly smooth, and it is a wavy hair. The hair is evenly distributed to the scalp and there is no lesion found as well as there is no lice found or being noted. Next is the face. So the patient's face is light in color and it is dry, and she has a dry skin. Next is the eye. So the external features of the patient's eye are symmetric in size and shape, and her eyebrows and eyelashes are evenly distributed. Next is the ears. So the ears are light pink in color. It is symmetric in shape and size. Next is the nose. So the nose are symmetric and there is no discharges found or noted. The mouth are dry and cracked. So the patient's lips are dry and cracked, and it is symmetric. So next is the tongue. The tongue is in the center and it is symmetric, and there is no lesion found or there is no inflammation found. As well as the neck, it is in the midline position and symmetric. Next is the upper and lower extremities. So the both extremities are equal in sizes and it is symmetric. There is no lesion or tenderness found. So the next is the diagnostic test and findings. So last February 19, 2020, this is the result of her CBC. So as you can see in her platelet count, she has only a 70 platelet count in February 19, 2020. So next would be February 20, 2020, and as you can see in her platelet count, it decreased to 43. And then next would be the developmental task. So the first developmental task that being mentioned here is the Erik Erikson psychosocial theory. It is in the stage of identity versus role confusion, age 12 to 18 years old. So during this stage, this stage is usually occur in teenage years to help develop their sense of personal identity, independence, and control. So during our initial duty, the patient seems to know what she really wants, and she also show the side of her being independent, and she express herself in a way that she wants to be. So next is the Sigmund Freud psychosexual theory. It is in the stage of genital stage. So in this stage, this is the final stage of psychosexual theory, wherein an individual develops a strong sexual interest to opposite sex, and it is ruled by id in young child to meet their basic needs and demand. So in our patient's case, so the patient are being ruled by the id, which means she during our rounds in clinical rounds in MAMC, she was being ruled by the id, in that she always know what she wants, and also she talk back to her mother as if she know what what to do, and she also doesn't have it was it was mentioned before that she doesn't have any boyfriend because she prioritized her studies first. So last would be the theoretical background. So next is the theoretical background. So the theory that is being applied in the patient's case is the environmental theory of Florence Nightingale. So, um, so in the case of our patient, it is correlated to the theory of Florence Nightingale, wherein the environment where she lives could be the leading factor on how she gets the mosquito bite. So after clinical checkups with the doctor, the doctor was able to identify some of the clinical signs on how the patient acquired the dengue fever. So it is always necessary to maintain cleanliness, especially in start in ourselves, then our house, then our surroundings, because it can be a leading factor on how we can get the dengue fever. On that, we need to eliminate some unused plastic pools, old tires, buckets that has stagnant water that mosquitoes could breed, and we should clean them, and uh, we should have a well ventilated environment because it is necessary for the patient's recovery. So that's all. Thank you.
When it comes to dengue fever, there are two systems that are mainly affected. These are the hematologic and immune systems. Now, before the pathophysiology and the disease process of dengue fever is discussed, we need to fully understand the systems that are being affected by the virus. By knowing the structure and the function of the components of blood and the lymphatic system, the comprehension of the path of disease will be made much easier. When one talks about dengue fever, we know about the different effects it has on our body, including increased white blood cell count, as well as decreased platelet count. In addition, we know that our immune system employs different types of defense mechanisms in order to combat the virus. Throughout the following paragraphs, we will describe how this is done in depth. First of all is blood. We all know that blood is classified as a connective tissue, and connective tissues contain cellular elements known as red blood cells, white blood cells, and platelets. Blood in particular has a unique extracellular matrix, which is the fluid plasma. The basic function is transportation. We know that nutrients are absorbed in the digestive system, which then are transported by blood to the liver. There it is processed and released into the bloodstream to be delivered to the cells. We all know that oxygen is transported in the blood to the rest of the body and circulates again. In addition, endocrine glands release hormones into the bloodstream, which are transported to target cells. Blood is also used as a disposal medium. For example, blood takes carbon dioxide to the lungs to be exhaled, as well as different waste products to the kidney and ureters to be eliminated from the body. Another major function of blood is to maintain homeostasis, which is done by a negative feedback loop. For example, when your body temperature rises, the blood is taken to the peripheral part of the body, which is cooler than the core. Lastly, blood is used as a defense mechanism. In the blood, there are many types of white blood cells that protect the body from any foreign threats such as bacteria, as well as viruses or DNA that has mutated. There are also different components of the blood. First of all, we have the erythrocytes, which have hemoglobin, which transports oxygen. Next are leukocytes, which are the main component of the body's immune system, and some examples are the basophils and the neutrophils. And lastly, thrombocytes, which are responsible for the blood clotting or coagulation. Next, we have the lymphatic and immune system. Resources define the immune system as a collection of cells and organs that destroy foreign invaders that could potentially harm the individual, leading to serious consequences such as disease or even death. To many, the lymphatic system is so highly associated with the immune system that they are used interchangeably. The lymphatic filters and carries excess fluid to the bloodstream through a system of organs and vessels. The immune system is a complex series of proteins, cells, and barriers that work together in order to protect the body from potential dangers. There are three phases of the immune system. The first phase are the barrier defenses, which consist of the skin and mucous membranes. These are the first line of defense when it comes to keeping out pathogens. The next stage, the innate immune response, provides a more specialized response, and it is considered rapid, however, it is nonspecific. The last phase is the adaptive immune response, which takes a longer period of time to activate, however, it is a specific defense that involves lymphocytes. The cells involved in the immune system are synthesized in the bone marrow for hematopoietic stem cells. There are three types of cells: lymphocytes that deal with adaptive immunity, phagocytic cells, and cells with cytoplasmic granules, which mediate immune responses. There are also components of the immune system. These include the tonsils and the thymus, lymphatic system, the bone marrow, spleen, and white blood cells. And also part of the lymphatic system is the thin-walled lymphatic vessels, lymph nodes, and the collecting ducts. Next, we're going to go over the immune response. Viruses are a type of microbe that requires cells in order to replicate. They hijack the different organelles in the cell, making it difficult for the innate response to recognize and destroy them. The primary mechanism against viruses are the natural killer cells, interferons, and cytotoxic T cells. The innate response starts off with producing type 1 interferons, which interfere with viral replication by stopping the synthesis of proteins or by promoting cell death. They can also act on neighboring cells to prevent the further spread of the virus. However, the ability to get rid of the virus is limited. For the innate response, the natural killer cells are the lymphocytes that kill infected cells to prevent the spread of the virus, as well as trigger type 2 interferons, which trigger other immune responses. Although the innate response can hinder the spread of the virus, the adaptive response is needed in order to fully eliminate it. The adaptive response is composed of T cells and antibodies. The antibodies can be used as a shield to prevent the virus from attaching to a cell. However, they cannot do anything once the virus enters the plasma membrane. The cytotoxic T cell response, though, is key, as it eventually overwhelms the virus and cells and kills the cells before the virus can complete its replicative cycle. Clonal expansion and the ability of cytotoxic T cells to kill more than one target cell makes these cells especially effective against viruses. Next, we'll go over the pathophysiology, starting off with the predisposing factors. First of all, the geographical area is a tropical island in the Pacific and Asia, such as the Philippines. The age is 14, it's a female and a child. Next is the precipitating factors, which start off with the environmental conditions, like open spaces with stagnant water, tires, plants, and pets, immunocompromised, and mosquitoes with a virus or sweaty skin. Now, this is the chain of infection. First, you start off with a susceptible host, which would be infected 4 to 14 days later. And the Aedes aegypti mosquito, the reservoir, which is a human, portal of exit from the reservoir, transmission, and the portal of entry to the host, and the cycle keeps repeating. So once there's the bite of the Aedes aegypti mosquito, which is the carrier of the dengue virus, the virus enters the bloodstream, which is the portal of entry, and the virus circulates in the blood, which has an incubation period of 3 to 14 days. Next, this will lead to viremia, which is a high level of virus in the bloodstream. This leads to the activation of immune response. Then, stimulations of WBCs, including cytokines and B lymphocytes that produce and secrete immunoglobulins, which are antibodies, and monocytes or macrophages, neutrophils, such as IgG and IgM. Then, there's the antigen-antibody complex, followed by the macrophages, which engulf the immune complex. Then there's viral replication and proliferation disseminating through either the lymph nodes to different body systems, or macrophages release vasoactive mediators like cytokines and leukotrienes. So through the lymph nodes, it can spread to the spleen, liver, bone marrow, and the platelets. For the spleen, this could lead to splenomegaly, erythrocytes pooling in the spleen, and abdominal girth increased. In the liver, it can lead to hepatomegaly, liver damage or altered enzymes, and leukopenia. In the bone marrow, there's infection of the megakaryocytes, which can lead to thrombocytopenia, increased vascular fragility or bleeding tendencies, which can lead to GI tract ulceration or integumentary disorders. On the platelets, there's destruction of platelets, which can lead to risk for bleeding or thrombocytopenia. Now, for increased vascular permeability, this will lead to plasma leakage. This can cause problems first in the GI tract, which can be seen in ascites. In the circulatory system, there's increased hematocrit, coagulopathy, which is DIC, circulatory failure or collapse, and hypovolemic shock, which eventually could lead to death. In the respiratory system, there's pleural effusion, decreased lung expansion, ineffective ventilation, which leads to respiratory distress and eventually death. For the central nervous system, there's dengue encephalopathy, which again will lead to death.
Hello everyone, my name is Berkeley Azaula, and my report is the nursing process. So for the prioritized nursing problem list, the first one is fever, the second one is abdominal pain, and the third one is risk for bleeding. So for the problem number 1, fever, the subjective cues are, nilalagnat po siya, ang init po ng katawan niya, as verbalized by the mother. Objective cues are, her skin is warm to touch, and her temperature is 38.4 degrees Celsius, so she has a high fever. So for her heart rate, it is 101 beats per minute. Her respiratory rate is 25 breaths per minute. Her blood pressure is 90/60. And we observe that she is very weak. She has dry mucous membrane, and she has flushed skin. So for the nursing diagnosis, hypothermia related to body's response to the infectious process. So the exogenous pyrogens induce host cells, such as leukocytes and macrophages, to release fever-producing mediators called endogenous pyrogens. The phagocytosis of bacteria and breakdown products of bacteria present in the blood lead to the release of endogenous pyrogens into the circulation. These endogenous pyrogens are thought to increase the set point of the hypothalamic thermoregulatory center through the action of prostaglandin E2. In response to the sudden increase of set point, the hypothalamus initiates heat production behaviors such as shivering and vasoconstriction that raise the core body temperature to the new set point, establishing a fever. So for the NOC, it is thermoregulation. Short-term goal is, after 2 hours of nursing intervention, the patient's temperature will lower down to normal levels of 36.5 to 37.5 degrees Celsius. So for the long-term goal, before the end of the shift, the patient will demonstrate behaviors to monitor and promote normothermia. So for the NIC, temperature regulation. So for our independent nursing intervention, we must provide tepid sponge bath. Tepid sponge bath is a therapeutic bath by washing all around of the body with warm water to decrease body temperature. So to assess, we should also assess fluid loss and facilitate fluid intake, because one of the complications of dengue is dehydration, which if not carefully monitored and treated may lead to shock. So it is important to instruct the patient to drink plenty of water to avoid dehydration. We should also assist the patient in changing into dry clothing. This may cause the patient's fever to rise even higher. Dress the patient in light, comfortable clothing, use a lightweight blanket or sheet when sleeping, change the patient's clothes, blankets, or sheet if they get wet. And lastly, monitor her vital signs every hour. Vital signs give the baseline when a patient is healthy to compare to the patient's condition when they aren't healthy. So we must monitor her vital signs, especially her temperature, because we need to know if her fever keeps rising or her temperature is getting low. So for the dependent nursing interventions, maintain IV fluids as ordered by the physician. A high fever and vomiting can dehydrate the body. And we should also administer paracetamol 800 milligrams every 4 hours. This drug is used to treat mild to moderate pain from headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold or flu aches and pains. And it also reduces fever. For the evaluation, short-term goal. Goal met. Patient's temperature lowered down to 37.4 degrees Celsius. So for the long-term goal partially met. Before the end of the shift, the patient was able to know how to monitor and promote normothermia, but was not able to demonstrate it. So for problem number 2, abdominal pain, the subjective cues are client's report of pain with a pain scale of 6 out of 10, with 1 being the lowest and 10 being the highest or the most painful. So for the objective cues, we observe that she has facial grimace, she is irritable or she has irritability, and she keeps guarding her stomach area or abdominal area. So for the nursing diagnosis, it is acute pain related to dengue infection. So acute pain serves as a useful function as a protective mechanism that leads to the removal of the source of the pain, whether it be localized injury or infection. So for the NOC, it is pain level. Short-term goal is after 8 hours of nursing intervention, the patient will report a decrease in pain level from 6 out of 10 to 4 out of 10. Long-term goal. By the end of the shift, the client will verbalize non-pharmacological methods that provide pain relief. The NIC is pain management acute. So for our independent nursing interventions, we should assess the pain characteristics. Assessment of pain experience is the first step in planning pain management strategies. The most reliable source of information about the pain is the patient, of course. Descriptive scales such as a visual analog can be utilized to distinguish the degree of pain. Get rid of additional stressors or sources of discomfort whenever possible. Patients may experience an exaggeration in pain or a decreased ability to tolerate painful stimuli if environmental, intrapersonal, or intrapsychic factors are further stressing them. For example, the room is noisy or the room is dirty, that would give her more stress. For the dependent nursing interventions, administer paracetamol 800 milligrams IV for every 4 hours. So the paracetamol has good analgesic and antipyretic properties. It is suitable for the treatment of pains of all kinds: headaches, dental pain, post-operative pain, pain in connection with colds, post-traumatic, and muscle pain. Migraine headaches, dysmenorrhea, and joint pain can also be influenced advantageously. So for our evaluation, short-term goal met after 8 hours of nursing intervention. The patient reported a pain scale of 4 out of 10. Long-term goal met. By the end of the shift, the patient verbalized non-pharmacological methods to relieve pain. For our problem number 3, risk for bleeding. There are no subjective cues, but the objective cues are irritable, restless, abdominal pain, platelet count of 70 grams per liter as of February 19, 2020. So for our nursing diagnosis, risk for bleeding related to altered clotting factor. The rationale for this is, during the early stage of infection, thrombocytopenia occurs as a result of bone marrow hypocellularity, resulting from direct dengue infection of hematopoietic progenitor cells and stroma cells. As the fever settles, bone marrow hypercellularity is seen, and increased destruction from immune-mediated clearance of platelets becomes the primary mechanism of thrombocytopenia. So for the NOC, blood loss severity, short-term goal, after 8 hours of nursing intervention, the patient will be able to demonstrate behaviors that reduces the risk for bleeding. Long-term goals, by the end of the shift, the patient will be able to display laboratory results for clotting times and factors within normal range. The NIC is bleeding precautions. So for the independent nursing interventions, the first one is to assess and monitor vital signs. Increased heart rate and orthostatic changes accompany bleeding. So we should also assess for any signs of bleeding. Bleeding may be obvious: bruises, petechiae, epistaxis, bleeding gums, abdominal pain, hematemesis, melena, hematuria. Should monitor the platelet count. Spontaneous bleeding can occur at platelet count lower than 50,000. Avoid IV and subcutaneous injections and rectal procedures such as enemas and rectal temperature taking as necessary. It can stimulate bleeding and to reduce unnecessary trauma. So we should instruct the patient to not eat dark-colored foods or drinks because the use of dark-colored fluids, chocolate drinks, red-colored juices can cause confusion by altering color of vomitus. Detection of blood in vomitus is an important sign that signifies severe disease. Instruct the patient to use a soft bristled toothbrush and non-abrasive toothpaste. Avoid the use of toothpicks and dental floss. This method providing oral hygiene reduces trauma to oral mucous membranes and the risk for bleeding from the gums. Instruct patient to limit straining with bowel movements, forceful nose blowing, coughing, or sneezing. These activities may cause trauma to the mucosal linings in the rectum, nasal passages, or upper airways. Teach patient about measures to reduce constipation such as increased fluid intake and dietary fiber. Hard and dry feces may cause trauma to the mucous membranes of the colon and rectum. Increasing fluid intake and dietary fiber soften the fecal mass for easier defecation. This is to also avoid for more bleeding if she defecates. And inform the patient to check the color and consistency of stools. Bright red blood in the stools is an indicator of lower gastrointestinal bleeding. Stool that has a dark greenish-black color and a tarry consistency is linked with upper gastrointestinal bleeding. And educate the patient and family members about signs of bleeding that needs to be reported to a healthcare provider. Early evaluation and treatment of bleeding by a healthcare provider reduce the risk of complications from blood loss. So for the dependent nursing interventions, there are none. For the evaluation, short-term goal met. After 8 hours of nursing intervention, the patient was able to demonstrate behaviors that reduce the risk for bleeding. Long-term goal not met. By the end of the shift, the patient's platelet count is 28 grams per liter as of February 20, 2020. Get rid of additional stressors or sources of discomfort whenever possible. Patients may experience an exaggeration in pain or a decreased ability to tolerate painful stimuli if environmental, intrapersonal, or intrapsychic factors are further stressing them. For example, the room is noisy or the room is dirty, that would give her more stress. For the dependent nursing interventions, administer paracetamol 800 milligrams IV for every 4 hours. So the paracetamol has good analgesic and antipyretic properties. It is suitable for the treatment of pains of all kinds: headaches, dental pain, post-operative pain, pain in connection with colds, post-traumatic, and muscle pain. Migraine headaches, dysmenorrhea, and joint pain can also be influenced advantageously.